American Cancer Society says over 300,000 women will be diagnosed with invasive breast cancer this year.
And for some of those women, that means having surgery, maybe even more than once, to make sure all that cancer is gone.
And a special report on Hasbrook takes a look at a procedure one hospital in Chicago is offering that not only helps preserve the patient's breast, but her sense of self.
I still see it in the mirror. Scars are fading. I don't feel distorted. I mean, for me, I was more concerned about that. I'm not a very vain person, but it was more about feeling whole afterwards.
Jody Simmons is a breast cancer survivor. When she was diagnosed 2 years ago following a routine mammogram, she says she didn't really know what to expect when it came to her surgical options.
So when this option was given to me, I thought it was a great way to approach the recovery, and for me, a healthier way to approach the recovery. And I think the recovery was not awful, and it's much easier seeing you look the way that you expect to look.
So Jody was diagnosed with a stage 0 breast cancer, which is a good thing in that it's caught so early, but it is a type of breast cancer that we can't see or feel. It's more of a microscopic disease. I often describe it as a sprinkling of cells throughout the breast, and sometimes we really do need to remove quite a bit of tissue in order to make sure we get it all.
Dr. Catherine Pesch is Jody's breast cancer surgeon.
As a breast surgeon, we're always worried about, am I going to make you asymmetrical if I remove too much tissue on one side, which, I view as a disservice to women. I never want to do that to a patient. So really with this situation she was in, I talked to her about that and that I didn't want to, have that as a potential side effect with resection.
So Dr. Pesch talked to Jody about a surgical option she hadn't heard of that could stop that side effect from happening.
So an oncoplastic breast reduction is a way that we meld a breast cancer operation with an aesthetic breast procedure.
Dr. Mark Sisko is the plastic surgeon who works side by side with Dr. Pesch when performing the procedure at Endeavor Health's Evanston Hospital.
This is, I think, one of the few operations where a cancer patient could go to sleep, have their cancer removed, and wake up feeling better about their body than they went to sleep. And I think that's one of the really great things.
So in Jody's case, Dr. Pesch performed a lumpectomy on Jody's left breast, while Dr. Sisko did a small breast reduction on her right side. He also rearranged some of the tissue on the left side to help her look balanced and feel normal.
So a lumpectomy alone takes about an hour. It's outpatient surgery. Recovery, I tell women, is about a week. By doing an oncoplastic reduction in addition, it doesn't add much to the recovery at all. We usually say maybe a total of 2 weeks instead of 1 week.
And I think the other nice thing is it's not uncommon that people with a larger tumor were able to avoid a mastectomy. And a lot of these people with larger tumors, a lot of these women in the past would have required a mastectomy, which is a much more challenging operation to go through. It takes more work to rebuild the breast after a mastectomy. It typically has multiple procedures.
Dr. Sisko adds that patients do better if these procedures are done at the same time and in conjunction with the rest of their cancer treatment.
Well, number one, we're avoiding a second surgery in a lot of cases. And as I mentioned, when people have radiation or other treatments, that can change the breast in ways, and that can oftentimes make it more difficult to come in after the treatment is completely done and fix things.
So perhaps one of the biggest benefits?
I would say one of the biggest advantages of the surgery is because we are removing tissue from both breasts, we can go a little bit wider with our margins to really ensure that we get clean margins in one surgery.
Clean margins means less chance of the cancer coming back. That is something Dr. Pesch and her team checks in the operating room.
We actually do take an x-ray right then and there while we're in surgery, and we can often see where the lesion is on the specimen, and we're hoping that it's right in the middle of the lesion. We're hoping to see a nice clear amount of tissue around it, and usually that can ensure that we're getting clean margins.
Because it's a microscopic disease, they still send the tissue they've removed to pathology.
More often than not, you know, most women do just fine, and we don't sign them up for the surgery unless we really think there's a really good chance we're going to be just fine.
But for many women in the U.S., the opportunity to have this kind of surgery may not be possible. Research articles in the National Library of Medicine cite a potential lack of available plastic surgeons in some areas. Another issue is simply being able to schedule the doctors to perform the procedures at the same time. That doesn't seem to be a problem, though, for Jody's surgical dream team.
Our schedules, we're able to line them up so that, you know, we have a lot of surgery time available for our patients. It's very common. We'll do 3 or 4 of these in one day.
For Jody, she's glad she had the opportunity to choose this kind of surgery.
It was a choice, and I chose to do it. And I'm really glad that I did, because you look at the scars every day in the mirror, and it just makes you feel, or at least for me, it made me feel whole.